My name is Crabtree. I will be starting at Blount Memorial in Forest South.
My name is Madison Wilson. I passed my NCLEX 2 weeks ago, and now I'm an RN in family birthing.
My name is Elissa Bates. I'm a new graduate. I am an RN. This is my second go-around. I'm a little bit older student. Was an office professional for many years. Went on, decided, that's really not what I wanted to do. I always had a love and a passion for healthcare.
A lot of people ask me why I've always wanted to be a nurse, and I've never had a great answer except for it's just always felt right. I've always wanted to be a nurse, and it's always just made me feel good to make other people feel good.
So my great-grandmother, she was in the hospital for a couple months. And while she was there, I was visiting one time, and there was a nurse that came in the room, and just the way she interacted with her, interacted with her like on a personal level, just really caring, talked to her, it was just the most compassion I had ever seen, and I wanted to be able to showcase that to people myself.
I grew up with a mother that was sick a lot. She had cancer 4 times, 3 different kinds. So I've always had that caretaker role, even from a very early age.
You having any pain this morning?
And I've always just been the kind of person that has the desire, to want to take care of people, and it just seemed like a natural place for me, really.
My grandmother worked here for, I think, more than 20 years. She worked in family birthing, and she's been a big inspiration to me. Growing up with her around, she taught me how to swaddle my baby dolls, and it's just always been kind of a part of my life, so it feels good to be here.
Now, I haven't had a hard time transitioning into Blount Memorial. It's been really easy here. It was very natural.
Blood pressure is 85/45. Patient's disoriented, drowsy.
Orientation is very thorough.
Long, but worth it. I've learned a lot about policies and things that make Blount Memorial work, and I think that's been helpful.
Some of them are the same size, some of them are the same color.
And that's kind of helped too, to understand how we work as a team and what to expect from each other.
They're going to attach to the life pack.
They give us plenty of tools and resources so that we know later on if we have questions or we're not sure how we should do something or what we should do in a situation. It's right there.
Nursing orientation at Blount Memorial Hospital is something that we put a lot of emphasis on and importance, on, just because when you're especially a new graduate nurse and you're coming out of nursing school, nursing school is really preparing you for, a lot of different things, but that first job that you have as a nurse is going to present different things to you that maybe you didn't learn in nursing school or maybe you didn't have practice with.
2 doses were given on night shift. Her pain is now at a 3 out of 10.
They really want to help you here. They really want to put you on the best path. A lot of employees are going to be like your family, so if you need help or you're in times of hardship, you just got to talk to somebody.
It is very nerve-wracking to be a new grad on a floor, especially when you're very new, obviously. But some things you just have to learn on the job.
How are you?
Hanging in here.
I always envied all the nurses every time I'd go into work because that's what I wanted to do, and I was so ready to do it. But actually getting to do the nurse work is what I'm so excited about, and actually getting to, instead of just being a part of helping the nurse, I'm actually the nurse.
I'm pretty nervous, but everyone says a little bit of nervous is a good amount of nervous.
I'm excited and happy for what I have ahead of me and what I've already accomplished now.
Everyone around you is very supportive, and so they're like, you can do it. And if an emergency happens or something happens, because it will, that you don't know what to do, they're still going to be there. Your team will still be with you.
You're not going to be alone, like you probably do feel with nursing school sometimes.
I feel good about the people I work with, and they're very helpful, and they'll help me kind of navigate through what I need to know.
From the moment you walk in the door, they're kind to just the people who are visiting. They're kind to their patients. They're kind to and receptive, actually, to new employees. And I mean, who doesn't want to work at a place where you feel like you're wanted,
When I toured the floor that I was working on, I really loved it. Millie, which is my nurse manager, she's so welcoming. it was really important to me. And Kathy, I love her. They're so welcoming and so inviting. And that's basically what I feel here at Blount, is just so welcomed.
You have to have the want and the desire to take care of people. If you have that, then I say go for it. We're facing a national nursing shortage, and this is a job where you're never going to run out of work. You're never going to have to worry. We're always going to have patients.
How's that feel?
And we always need great healthcare workers to take care of those patients.